for the end term is about the nervous system. Okay, so your nervous system is divided into the central nervous system and the peripheral nervous system. As physical therapists, you will be dealing with patients who will have central nervous system problems as well as peripheral nervous system problems. So commonly, the neurologist will refer patients to you with CNS problems, and we orthopedic surgeons will refer to you patients who will have peripheral nervous system problems. So commonly, the orthopedic surgeon will deal with severed nerves. So commonly, ang nag-deal ng mga subspecialty under orthopedics are the hand surgeons. So they do repair of the nerves, they do microscopic repair of the nerves, and hopefully, it will recover. But, it is the role of the PT to restore the function. So, ang role ng surgeon is only step number 1. Step number 2 up to 10 belongs already to the patient and the physical therapist as the star of the show. So, hopefully, the nerves will regenerate. Kabalin ako mo, no? Ng terms for nerve damage. Wala pa? No idea pa? Okay. So later on, as you go up the ladder, you will meet the terms neuropraxia, axonotmesis, neurotmesis, and those are different intensity or different severity of nerve injuries. So anyway, the central nervous system will deal with the brain and the spinal cord, while your peripheral nerve system will deal with highlights. So, So, while the peripheral nervous system will deal with your motor neurons and your sensory neurons. So your sensory neurons provide information from the external environment or from the target organ going back to the brain. While your motor neurons provide nerve supply from the brain all the way down to the target organs. So your motor neurons are further divided into two. You have your somatic nervous system, that's the system that provides nerve supply to your skeletal muscles, enabling you to do all of your voluntary movements. Your autonomic nervous system, on the other hand, provides nerve supply to all your organs and your smooth muscles. So organs that have smooth muscles are governed by the autonomic nervous system. They are involuntary or they have automatic responses. And your autonomic nervous system is further divided into your sympathetic and parasympathetic. So your sympathetic nervous system is responsible for your fight and flight responses, while your parasympathetic system is mainly involved with the maintenance of your body. So your parasympathetic system is also known as your rest and digest system. Okay? So again, your central nervous system is made up of the brain and the spinal cord, while your peripheral nervous system is made up of the axons. Axons that come from the brain and the spinal cord and connect the brain and the spinal cord to your limbs and to your organs. So, diba, your neuron will have its axons. So, the axons are very, very long and can be millions of miles from the brain all the way to its target organ. So, if you map the brain, the spinal cord, as well as the axons, so your axons will now become your peripheral nerves. Okay? So your central nervous system is organized in such a way that centrally you have your gray matter, and externally or peripherally you have your white matter. Okay? Your gray matter is made up of your neuron cell bodies, so that's the cell bodies of your neurons, your interneurons, and your unmyelinated fibers. While your white matter is made up of the axons of the myelinated axons of the gray matter. So, your white matter is located both in the cerebrum and the cerebellum. your cerebrum is divided into different lobes. You have your frontal, your parietal, your temporal, and your occipital lobes. And under that is the cerebellum. Okay. So if you look at your brain has a large surface area. So even if it's just located in our brain, no, the area looks as if it's small, but its large surface area increases. I mean, the size of the brain is increased by its large surface area to supply all the organs and the tissues of our body. So you have your right and your left hemispheres, and your right hemisphere controls the left side of the body, while your left hemisphere controls the right side of the body. So this hemisphere is connected by your corpus callosum. Your corpus callosum is a collection of axons that connect the right brain to the left brain. So it serves as the communication between the two hemispheres. That is why what you're doing with your right, your left nose, and what you're doing with your left, your right nose. So any damage to the corpus callosum will separate the two hemispheres. So 60% of all of us, most of us are right-handed. Right? Almost all of us are right-handed, but the speech is controlled by the left hemisphere. Okay, that is why if you have a left hemispheric stroke, usually the person's speech is affected. So you will see these patients and you will help rehabilitate them so that they can talk again. Okay, so studies have shown that if you damage the corpus callosum, your patient will have a split brain, or they will have two independent brains. And this is how researchers discovered that there is hemispheric specialization between the two hemispheres. So we will discover later on that the right brain is associated with musical ability. So if you have a larger surface area of the right brain, you're more musical, you're more artistic, you're very good in drawing because you have very good visuospatial brain areas, larger visuospatial brain areas. However, your left brain is associated with speech and language. So even if you're left-handed, regardless of whether you're right-handed or you're left-handed, the speech and language areas are located in the left brain. So when you have a left hemispheric stroke, commonly, the speech and the language are affected. Okay? Okay, so for the left brain, remember, this is the summary of the hemispheric specialization. Left brain controls the right side of the body and the right visual field. So that is why in stroke patients, you see them, you can see them with hemi-neglect. There are some whose left brain is damaged. They cannot see what is on the, left brain is damaged. They cannot see what is on the right side. That is why if you present an object to them on the right side, they will not be able to recognize that because they cannot see, or they have cortical blindness. Even if their eye is good, their optic nerve is good, the integrity is good, their brain cannot interpret the signal. So you transfer it to the left side and they're able to see that. Speaking. So remember, speech and language are located in the left brain. Reading. So commonly, these patients will have difficulty interpreting letters, interpreting numbers. Sometimes, when you present a word to them, the letters are jumbled because of how their brain will interpret it. So you have patients with dyslexia. Then logical thinking. So patients who have difficulty analyzing the situation and making logical decisions, they might have problems with the left brain. Analytical skills, sequential processing, what goes first, what follows, that is the work of the left brain. The right brain, on the other hand, controls the left side of the body and the left visual field. Wala talaga na-emphasize sa eye, no? Remember, sa eye, nag-deposit siya on the other side. That is why if the brain is damaged, there is no interpretation of the signal. So, may ara ka, cortical blindness. Facial recognition is responsibility or function of the right brain. Music is a function of the right brain. Emotional expression is a function of the right brain. Holistic thinking. That is why, do you watch Big Bang Theory? Sheldon. You watch that? So you can see that Sheldon is left brain dominant and Missy is right brain dominant. So that is how hemispheric specialization is. So aside from that, based on embryologic development, you can also classify your central nervous system or your nervous system or the brain into the hindbrain, the midbrain, and the forebrain. Okay? So the hindbrain is the most primitive. So this is made up of your cerebellum, your pons, and the medulla. So mostly, your instinctive actions are located, or this part of the nervous system is responsible for all your basic and instinctive reflexive functions. For example, your cerebellum is responsible for your balance and coordination. So those are basic and instinctive functions. Your pons and medulla, that is where your respiratory center resides and part of your wakefulness. Okay? So basic and reflexive functions are the responsibilities of the hindbrain. So the medulla mainly functions for your cardiovascular and digestive system. So it controls your heartbeat, your digestion, and your breathing. That is why in the event that the medulla is damaged, then the patient will really die. So commonly, you have conditions wherein a patient might sustain a traumatic brain injury during a vehicular accident. And now, the pressure in the brain increases, probably because of bleeding or because of edema. However, remember your skull is fixed and it cannot accommodate the swelling brain. So what will happen is that the pressure inside the skull will push the brain down through the foramen magnum. Diba? At the bottom of your skull, you have the foramen magnum. If the pressure inside the brain is so great and the skull, of course, cannot accommodate that because it's fixed, it will push the brain out of the foramen magnum, and you call that as a brain herniation. So later on, when you have patients who have been referred to you with traumatic brain injuries and they have problems with intracranial pressure, what you can do is every time you do your exercises, always check your blood pressure. You have a pen light with you, or you always have your cell phone with you. You can check the size of the pupil. If the size of the pupil is asymmetrical, such that one is pinpoint and the other one is dilated, then that can be a sign of impending brain herniation. So you have to be careful with that. Because the first structure that gets damaged in a brain herniation is the medulla. Medulla. Depends where you come from. But both pronunciation is correct. Remember, your medulla is responsible for your very basic functions, your vital functions. So the patient can die. So, medulla, for ease of remembering, life support. Okay, here, you can see that the medulla is at the most bottom, followed by the brainstem, followed by the forebrain. So, where the thalamus is. So this is just for ease of remembering. So this is what I meant when I said that part of your wakefulness is located in the hindbrain. And that is your reticular formation. Because the reticular formation is made up of different areas of the brain. Okay, next is the pons. So after the medulla is the pons. So the pons serves as a bridge between the medulla and the cerebellum and the rest of the brain. And part of its responsibility also deals with respiration, with movement, because that is where your pyramidal tract decussation occurs at the pons. sleeping, waking, and dreaming. So damage to the pons can also affect your movement, aside from your basic functions, vital functions. The cerebellum is also known as the little brain because it is shaped like the cerebrum, but is smaller in size. So this is responsible for balance, coordination, and movement. So when you want to test for integrity of the cerebellum, you make the patient walk a straight line. You call that as the tandem walk. So if the patient is unable to walk in a straight line, then that means that he's either drunk or he has cerebellar dysfunction. Okay? So commonly, ang mga drunk people, if you make them walk a straight line, why hindi sila walk a straight line? And to maintain their balance, what do? They will increase their pace. So they either will spread their feet apart or they will spread their arms for balance. Kita nyo na, mga tightrope walker, grabe no, meaning their sense of balance is really good, meaning dako-dako, ginaila, cerebellum. Okay, so you have your cerebellum for balance and coordination. So coordination, you can also do your, nga movements. Mga coordinated movements, you know that? Oh, so you test your patients, mga finger to nose test. That's how you test for the cerebellum. Finger to nose. Touch, you tell the patient, touch your nose and touch my finger. Touch your nose. Sige, touch your nose. Touch my finger. Nose, finger. So you can follow. Or your, my gosh, Alzheimer's. Mga coordinated movements. So, those of you who are really very, very good dancers have very, very good cerebellar function. And I do not belong to that group. If you want to have an injury, a physical injury, dance with me. And I'm sure you will get it. Okay. So, the midbrain, on the other hand, is the one that coordinates our visual and auditory reflexes. No? And part of it is the reticular formation. Most of the reticular formation is in the midbrain, and part of it is also in the hindbrain. So your reticular formation is the area of your wakefulness, and any damage to the reticular formation will decrease your wakefulness. So you can be sleepy, obtunded, lethargic, or comatose, and that will come from any damage to your reticular formation. So aside from that, your reticular formation also filters your sensory information and will alert your higher brain centers to important events. Events, hindi yung maskara ha. Events in the body, bala, like bunon ka na bisang imo nga. Kita mo, di ba? If you have an enemy, your wakefulness increases. Yes. So that is the hindbrain, the midbrain, and now the forebrain. Of all of these, the smallest is the midbrain. Okay? So amon yang red niyo, this is your reticular formation. Red. Your midbrain, your forebrain, and your midbrain, and your hindbrain, they also house your cranial nerves. So your cranial nerves will come from that area. Okay, the forebrain refers to your cerebrum. That is the largest and most advanced brain division that you have. It allows you to have complex thoughts. It allows you to have the behavior that you have in relation to the situation that you are in. It allows you to have logical thinking, analyze what is going on, and refines your responses through your thought, judgment, and your inhibition. No? So, kung bata ka pa, di ba, hindi pa well-developed yun ang mga brain. Wala kayo na huya, biskan diin ka lang mauba. So, wala ka pa, malis siya. As you mature, you already, inhibitory systems are set in place as your brain matures. That's why you become inhibited. You do not do things that are not acceptable to the society. You become not really shy, but the way you act, the way you respond becomes more refined. So you have control. You have control of yourself. You have control of your temper. You have control of your response, your emotional response. Sa bata ka pa ya, gubain mo nga, ano ka, bibi ka, ay, guba mo niya, I don't like you, diba? Pero mga bata naman yan, they tell each other, I don't like you, but after 5 minutes, they're back to being friends. Ang mga mature ya, grabe na ginaya, kay pwede magdumtanay. Pwede na. Okay. So, the forebrain. Part of the forebrain is your thalamus. Your thalamus is simply a routing station or an air traffic controller. So, kwan lang ni siya relay station. Mamba si thalamus, taga diin ka, taga Bago, dito ka sakay. Diin ka, Bacolod, dito ka sakay. Diin ka, Silay, dito ka sakay. So, that is what the thalamus does. The thalamus receives all information and tells the brain, this is for pain, you go to the pain center. This is for touch, you go to the touch center. This is movement, you go to the movement center. That is what the thalamus does. It processes sensory information, organizes and sorts them before they reach the cerebral cortex for interpretation and for perception. Okay, so that is the thalamus. The hypothalamus is located below the thalamus, but its action is different from that of the thalamus because what it does is it controls complex behavior associated with eating, drinking, and sexual activity.
Hormones.
So, hambal nila, ang hypothalamus contains the 4 Fs. Later, the 4 Fs. What are the 4 Fs? Sorry, Gida, the last F is a little bit obscene. Pero permi nyo na mabatian ka lang tawag mo Deadpool, di ba? That's Deadpool's favorite word.
Feeding.
Okay. So you have food, fight, flight, and fornication. Okay? At least, ay salamat, ginislan ko na gali. Okay, before, ang nakabutang na di is ang favorite in the word ni Deadpool. Okay. So, what about your emotions? Your emotions come from your limbic system. So, your limbic system is an interconnected group of brain structures that includes your hippocampus and your amygdala. And this is referred to as the pleasure center of the brain and is highly associated with your emotions, your memory, and your social behavior. So, amo nang ambal nila bala, I love you with all of my limbic system. Or I love you with all of my hippocampus. That is true. I love you with all of my amygdala. Ang I love you with all of my heart, peke na. So, this is highly associated with your emotions, memory, and social behavior. They actually did a study wherein they implanted a microchip that will stimulate the limbic system in monkeys. Or, sorry, not in monkeys, but in rats. No, every time a rat, they put the rats in a cage. No? And there's a button there that when the rat presses that, there is a shock delivery. There is a little bit of, there is an electrical current that is delivered to the limbic system. And the rats feel pleasure. So, and then they also put their water and food for the rats to eat so they can survive. You know what the rats did? They did not even saw the food and water. Pabayaan ko nilang food and water. All they did was press the button until they died. So that is how dangerous your limbic system is if there are no inhibitory processes that is set in the brain to control the limbic system. So this is what you stimulate when you do drugs. If you have vices, ang mga vices, bala that you find pleasurable, that you stimulate your limbic system. And you find it so good that you cannot stop. Because it is the limbic system that is being stimulated. And whenever this system is stimulated, you find pleasure in all of the things that you do. So, this is your limbic system. No? You have your amygdala, the pink structure here, and your hippocampus. Your hippocampus. And there, that pink there is your amygdala. Gin padako ko lang kayo kagamay. Okay, questions? Let's move on. We're halfway there. So the cerebral hemispheres, your cerebrum is divided into two, diba? Right and left. And you will have your fissures there. So your longitudinal fissure, this is your longitudinal fissure, is lang, kabilang color. This is your longitudinal fissure. So the longitudinal fissure will divide the brain into right and left cerebral hemispheres. And your transverse fissure, aring transverse fissure, sala lang ko. This is the transverse fissure that will divide the cerebrum from the cerebellum. Okay? Here, this is a better view. The cerebrum from the cerebellum. And you have sulci and gyri that will increase the surface area of the brain. So studies have shown that if the gyri and sulci are many, the person is more intelligent. The more information you gain, the more sulci and gyri you develop. Okay? So, hindi na ko niya magpa-memorize sa inyo, ha? Mula ng longitudinal, kag ang transverse fissure. Okay? So the cerebral cortex is the home of our consciousness. So you will find there neuronal bodies, your dendrites, and your axons. So the fold in the cortex, the formation of gyri and sulci will triple the size of the cerebral cortex. And 40% of the brain mass belongs to the cerebrum. So there, you have the different areas of the brain. You have the frontal lobe, the temporal lobe, the parietal lobe, and the occipital lobe. And all of these lobes will have different functions. But mainly, they're involved in memory, perceptual awareness, thinking, language, and consciousness. So in traumatic brain injuries, if you have damage to the cerebrum, your patients may have amnesia. They may have different perceptual awareness. So, pananaw nila, kasi mo yan, aswang ka, demonyo ka. No? So, those are your patients. You might be dealing with patients with schizophrenia who will have hallucinations and delusions. And they will perceive the environment differently from the way you do. So, una, nag-rotate ko sa intern, nag-rotate ako sa psychiatric ward na kulbaan, ko primero. Kaya yung pasyente ko, hambali na, hamba ko, mama, yung gabi, mainom ka na sang bulong mo ha. Hambalya, isol. Ha, very good. Dara ka lang ha, hindi ka gida maglakaw sa linya, maging kurit ko. Kay karon malabot ka gida sang kamutya. Wow mo na siya. And they have all of these hallucinations and they have delusions. May isa ka na kapasyente nga, Hoy, nga gindagdag mo nga kung na corona, pujuta. Pero pati ka na, namusuon na da siya. Hambalon, tikis agin na patulan, man siya na mga ba. Dali lang gid kita, guna mo ng mahal na hari. May natawag naman janitor to pick up. May isa man na ka, gusto ko ya sa imo lang ko ya ka may istorya. Kanya, kung nga ako daw, mas gwapo na siya sa sasakon. Kung hindi ko na sa iya, kay wala na siya power, hindi siya katulog sa akong mata. So, these are some patients that you might eventually encounter and you need to learn how to deal with them. So, slowly as you go up the ladder, you will be taught by your mentors how to do that. Okay, may iban, gidiyang makibot ka na lang. So, that is why it is very important you always look at the history of the patient. You look at the examinations of the patient's doctors. You talk to the folks to validate para you will know how to deal with your patient's queerness or your patient's peculiarity. Okay. So the most important in the frontal lobe is the primary motor cortex because as physical therapists, you will be referred patients who have problems with your primary motor cortex. So your primary motor cortex controls the fine movements of the body. And you will have patients who will not have these movements and you need to rehabilitate them so that they develop functional movements again. So each area of the primary cortex are different, or the size of the, or depending on the movement that the body needs to do, there is a specific area allotted to that body part. So that is called your motor homunculus. So in your motor homunculus, you can see here that the body parts that we devote to more movements have larger areas in the brain. And it's a good thing that we don't look like how we are represented in the brain. For example, our mouth, our face, we use them most of the time we use them. Okay, imagine mo, what is the most commonly used joint in your body? You think, what do you think? Correct. It's your temporomandibular joint. That is why the mouth has a very, very large representation there. Furthermore, because we talk most of the time. Of all the body parts, it is the hand that we often use more than the others. That is why its representation in the brain is also large. So that is your motor homunculus. So another part of the frontal lobe is your prefrontal cortex. Your prefrontal cortex is responsible for critical planning. And this involves memory, problem solving, emotion, complex thought, because all of these functions are necessary if you want to do critical planning. Imagine na lang bala kung nalipat ka, nag-plan ka para sa isa ka birthday, tapos lipat-lipat ka, nalipat ka sang balloon, nalipat ka sang cake, nalipat ka sang candles. What kind of birthday party would that be? So all of these are related to or important in critical planning. Okay, so frontal lobe na to ha. Next is the parietal lobe. Your parietal lobe is the one that processes information to interpret the different sensations that you get from outside of the body. So it's important for touch, pain, temperature, and awareness. And because of these sensations, your parietal lobe is able to specialize in your body senses and body image. Okay. And in the parietal lobe, you have your primary somatosensory cortex, which deals with interpretation of sensation. And you have your association area, or sensory association cortex. The primary association sensory cortex is responsible for interrelating the different sensations that you have. For example, naghikap ka sa hedgehogid. Ang lapit-lapit lang di sa atin. Ang sa dagat, ang lang na may spine, may ginakaon. Sea urchins, no? When you touch the sea urchins, you feel the pain. Diba? So, pero ma-feel mo man nga daw relatively circular siya. So, those sensations are interrelated by the association area so that you interpret, your primary somatosensory cortex is able to interpret. Okay, so like your motor homunculus, you also have your sensory homunculus. The parts of your body that are used for touching and for sensory awareness will also have greater representation. So remember, larger areas are devoted to the most sensitive parts of the body, while less sensitive parts will have smaller representation in the brain. So, mas sensitive gid ang inyong hands kagang inyong lips. So, as a baby, you use your mouth to learn. Diba? As you grow older, you realize that you use your mouth for feeding and not for learning na. Your learning shifts to your hands. Okay, so if you look like how you are represented in your brain, this is how you will look like. Hello, ay galing, no? That's how we look in our brain. If you ask the brain how you look like, that's how you look. Okay. So that is the parietal lobe for sensory. Next is the temporal lobe. This is the main area that is used for processing of hearing and other complex aspects of vision. So you have face recognition, motion detection, and also, of course, all of the different lobes are interrelated for learning, memory, and emotions. The occipital lobe naman niya is located posteriorly and responsible for vision and visual perception. That is why, amo ng phrase, Bella, that's what the phrase means, eyes at the back of my head. Mama, how did you know? And your mama will tell you, because I have eyes at the back of my head. Ang bilan mo ka muna sa mama niyo, no? Na don't bother keeping secrets from me because I know everything. Correct? Amo ginasa uli, when you become parents, you'll say the same thing to your children. So, for ease of identifying the different functions of the brain, si Brodmann divided the brain into the different Brodmann areas. So later on, sa inyong neurology, you will encounter Brodmann areas. So you have Brodmann area 1, 2, and 3 is your primary somatosensory cortex. Your Brodmann area 5 and 7 is your somatosensory association area. Your Brodmann area 4 is your primary motor cortex that deals with the execution of movement. And your Brodmann area 6 is your premotor cortex that is responsible for planning of movement. So you plan your actions in Brodmann area 6 and you execute them using Brodmann area 4. Your Broca's area is area 44 and 45, responsible for speech, for interpretation of speech. While your area 22 is Wernicke's area, which is responsible for execution of speech. So when Broca's area is damaged, the patient knows how to talk, but he doesn't know what he's talking about. If Wernicke's area is damaged, the patient doesn't know how to talk, but the patient can understand. And then you have area 17, your primary visual cortex area. Mula na, importante. Okay? So I just want you to remember areas 1, 2, 3, 4, 5, 6, 7. And areas 44 and 45, primarily 44. Area 22 and area 17. Broca's area, area 44. Speech. Area. I think in-emphasize ko man na di later. Ang Wernicke's motor part of speech. Oo. Ang Broca's is interpretation of speech. So, if you have damage to Broca's area and Wernicke's area, your patients may have what is known as aphasia. Okay? Tingnan yan. Okay, the diencephalon is important because for examination purposes. So just remember that the diencephalon is made up of the thalamus, the hypothalamus, and the epithalamus. For examination purposes lang na siya. Okay? And for ease man of studying about the hypothalamus, the thalamus, and the epithalamus. So remember, the thalamus is just a relay station or the gateway to your cerebral cortex. Your hypothalamus now is important because this has a better academic impact. This is the master gland of the pituitary gland because it dictates what the pituitary gland will do. So you have your hypothalamus here, you have your pituitary gland there. And your hypothalamus produces pituitary releasing hormones so that your pituitary gland can signal the target organ to produce that hormone. So your hypothalamus, even though gamay lang siya. It helps control the ANS by the hormones that it allows to be released, thus controlling emotional responses, body temperature, hunger and thirst, behavior, sleep-wake cycle. In summary, it controls the endocrine system. And the epithalamus, on the other hand, is the one responsible for secreting melatonin. And this is the hormone that is responsible for your circadian rhythm. That is why kabalo ka kung gabi, kabalo ka kung aga. By the way, melatonin is produced when there is darkness. So that is why kung magdulog na, nagkakatuyo ka. That is also known as your sleep hormone. So muna nga kung pasigahan ka suga, kadugay sa imo tulugan compared sa ibutang ka sa dulog na kwarto. But because of the automaticity of the epithalamus, iskan ibutang ka sa Bartolina for 60 days, nagabugtaw pag hindi ka siling natulog ka lang all the time. Okay? Questions? Wala na? We're almost at the end. So, the next part is the spinal cord. The spinal cord transmits signals from the brain to all your sensory organs and muscles. It also serves as a pathway to transmit stimulation or stimulus that have been converted into action potentials from the target organs all the way back to the brain. Okay, so it serves as a superhighway between the brain and the rest of the body. So your spinal cord is composed of your sensory or your afferent neurons and your motor neurons or your efferent neurons. So your sensory neurons responsible for sensation. Your motor neurons responsible for movement. Ay, tapos na. And behavior-wise, it is also affected by the limbic system and the cerebral cortex. So you have your preganglionic neuron coming from the brainstem and the spinal cord, and your postganglionic neuron from the autonomic ganglia. So for the sympathetic system, you have short preganglionic fibers and long postganglionic fibers, while the reverse is true for the parasympathetic system. And this is how, ay wala na di. Okay. Later on, I'll show you how it looks like. So your sympathetic system is located from T1 to L2. So at the intermediolateral horn of the spinal cords, level T1 to L2. So commonly, nagagwa sa exam, T1 to L2. So the axons will leave the ventral root and then terminate at its level of origin, or they will ascend and terminate at a different level, or they will enter the sympathetic chain without synapsing. So, you have your preganglionic sympathetic fibers that secrete epinephrine and norepinephrine, and this comes from the adrenal medulla, which is located in your adrenal glands near the kidney. And they do this without synapsing. So, like this. So, number one, these are three pathways of your sympathetic nervous system innervation. Number one, they will synapse at the same level. There. Number two, they will synapse at a higher level. Or they will not synapse at all. So they will go straight to the end organ without any synapsing. So you can see here, no, for the sympathetic system, di ba, short preganglionic fibers and long postganglionic fibers. So magambal ka nga preganglionic from the brain, from the spinal cord level, at the spinal cord level. And the fibers that will terminate to the end organs are the postganglionic fibers. So for these are the sympathetic trunk chain. So you have 3 cervical, 11 thoracic, Di ba sa spinal cord mo, amo ni siya, no? Amo ni siya ang imo nga paravertebral ganglia. May 3 ka cervical, may 11 ka thoracic, 4 lumbar, 4 sacral, and 1 coccygeal. Paravertebral ganglia na iya. But ang iyang origin is only from T1 to L2. Your parasympathetic nervous system naman niya comes from spinal cords S2 to S3 and cranial nerves 3, 7, 9, and 10. Okay? So for 3, this controls your pupillary sphincters, so your eye reflexes. For 7, it controls your lacrimal, nasal, and submandibular glands. That's why kung kakita kapag ka, o nagalalaway ka. Or kung kahang-kahang, nagaluluha ka. Cranial nerve controls the parotid gland, and cranial nerve 10 is the vagus nerve. Part of it controls the heart, lungs, esophagus, stomach, small intestine. So mainly, the vagus nerve controls respiration and digestion. So with regards to the heart and lungs, the purpose of the vagus nerve is to slow down the heart and slow down the breathing. So muna ginatawag nyo ba lang a vagal massage? No? Vagal massage to slow down the heart and slow down the breathing. And your parasympathetic fibers will also, the sacral segments will control the descending colon, descending colon, rectum, bladder. So kung daw mapika or daw mapuka, that's the role of your spinal cord segments S2 to S4. So these are the different neurotransmitters related to the ANS. So cholinergic fibers, all ANS and all parasympathetic postganglionic neurons will need acetylcholine. While your adrenergic fibers will need your norepinephrine. So this is for most sympathetic postganglionic axons. But all preganglionic axons, regardless of whether it's sympathetic or parasympathetic, will need acetylcholine. So again, cholinergic receptors are for acetylcholine. Adrenergic receptors are for norepinephrine. For your cholinergic receptors, you have 2. You have your nicotinic and your muscarinic. And these are important because later on you will have drugs that will stimulate your nicotinic receptors and your drugs that will stimulate your muscarinic receptors, and they will mimic the effects of acetylcholine. The effect of acetylcholine on nicotinic receptors is always stimulatory. And however, on muscarinic receptors, they can either be inhibitory or excitatory. Kapoy na kamo, no? So this is just a summary of the different types of cholinergic receptors and their effect when they bind. So, kung nicotinic, always excitation. Kung muscarinic, it can be excitation, it can be inhibition. So these are your adrenergic receptors. No, this is just a summary of your adrenergic receptors, and they will have different effects on their different target organs. I will leave this for you to study. And these are different drugs that will act on those different receptors. So you have atropine. Atropine is commonly used in surgery. They prevent salivation, and they also prevent the heart from slowing down. So when the heart slows down, the patient is commonly given atropine. Later on, you will have patients who have myasthenia gravis. And this is a neurotransmitter or a synaptic problem wherein you have very low numbers of acetylcholine receptors. So that is why your patients present with motor weakness. And they have what you call as the sundowning effect. Kung nagahapon, nagaluya, nagid sila. So they're given drugs that inhibit acetylcholinesterase. Eh di ba, ang acetylcholinesterase, gubon niyang acetylcholine. Problem mo is, damo ka acetylcholine, but your receptors are very low in number. So dapat, ang acetylcholine mo, i-maximize mo siya para nga you maintain your motor strength. Or you maintain the transmission of an action potential to create motor movement. So, ang neostigmine, it will prevent the breakdown of acetylcholine by inhibiting acetylcholinesterase. So, biskan dutay lang ang receptors mo, kay damo ka acetylcholine, you can sustain the transmission of action potential to create muscular contraction. You have over-the-counter drugs for colds and allergies. They stimulate your alpha-adrenergic receptors, your Bioflu, your Neozep, Nasatap, Dimetap. And you have your beta blockers. These are drugs that attach to your beta-2 receptors. So your beta blockers are your salbutamol, and you give them in patients with asthmatics, or with asthma rather. So these are different drugs that can affect the activity of your autonomic nervous system. I will post this in the Teams. So nagligad, I would like to apologize nga wala ko na post ang inyo balang lecture sa exercise. Kaya kundi nagbagyo to, and brown out gidya sa amon for 2 days. That means 2 days man ako nga wala, nakapaligo. Sa balay namon. That's why nakiligo lang ako sa Amon Clinic. Oh, no kuryente, no? Naparsagit kami mangita generator. Okay? So I will post this para nga you can have time to read on it. So remember, your autonomic divisions, they interact with each other. They always are in control, and this is governed by the pinaka-favorite na control mechanism of the body. It's through negative feedback. So when the sympathetic system overexerts itself, it is controlled by negative feedback, the same man with parasympathetic system. That is why kung nagsaka ka halin sa ground floor all the way to the 8th floor, di ba? Grabe gid ang beats ang imong heart, no? And if that continues, you can die. Okay? So that is why it is very important to have the negative feedback control system in effect. So your sympathetic system controls your blood pressure and your vasomotor tone. So because remember, dapat may tone gid ang imong blood vessels to keep your blood moving around the body, even at rest. So your sympathetic system constricts the blood vessels, and when the blood vessels are so much constricted, they fire less rapidly, so that there can also be vasodilation to control or decrease the blood pressure. So you have drugs that are that inhibit the sympathetic firing to treat hypertension, and those are your alpha blocker drugs. You also have drugs that block your parasympathetic responses. And these are used to treat problems with heart rate, problems with fecal and urinary retention. Paginon mo nilang kung hindi ka kapabos. So they work together, no? You have cooperative effects seen in the erection of the penis and in the ejaculation of semen to promote the maintenance or the existence of the human race. So parasympathetic, para hindi ka mo matalang, parasympathetic, laba nga word. So erection. Sympathetic, shorter than parasympathetic. So responsible for ejaculation. Okay? Okay, mag-ejaculate, din nagalipot na siya. Kung erected pa siya, laba siya. So, parasympathetic. Anyway, these are the drugs that you will meet in your pharmacology. But it would be nice for you to know this already. No? These are you have sympathomimetic drugs, meaning drugs that mimic the effect of the sympathetic nervous system. And your parasympathomimetic drugs, drugs that mimic the effect of the parasympathetic system. Parasympathomimetic and sympathomimetic. So I will post this so that you will already meet this drug so that later on in pharmacology, it will not be too difficult for you anymore. So these are just examples. Ang diin ta. Oh, your hemorrhoids are blood vessels nga naga-dilate. So you want them constricted. So sometimes it's part of the mga anti-hemorrhoidal creams. Kinaga-dilate na sila. So you want them constricted. So amo na siya, no? Mga drugs, different drugs you can use. I-post ko lang niya. Kay tama na ni siya kadamo. Okay? Mga drugs that prolong activity of acetylcholine, mainly used in the treatment of myasthenia gravis. And you have drugs that block cholinergic activity. So commonly, ang ma-encounter you get will be atropine. Okay, atropine is used for bradycardia. So kung nag-slow down na ang beating sa heart, ginatagaan sila atropine. But you cannot use atropine for a long time. So there are some patients who will need pacemaker for this. So, anyway, this last slides, 1, 2, 3, 4, 5, 6, 7, 8. So, the remaining 8 slides, mga drugs man lang na siya. I don't think it's really important to discuss them with you at this level. But I just want you to get to know them so that because later on, you might meet them in your pharmacology subject. Basta, rest and digest, parasympathetic. Okay, so, during exercise, your heart rate increases. Sympathetic, para? Okay. You saw, anong pinakanamit ng cake, subong man? Tres leches. Do you like tres leches of Maria Cocina? So you saw tres leches of Maria. Oy, mas namit ang ubi cake sang Felicia's. The best gid ang ube cake sang Felicia's galing kay ulas laga baligya slice. Diya sila. Okay, so you saw ube cake. You started to salivate. Sympathetic, parasympathetic. Okay, parasympathetic. You are in a jungle. You need to see your enemy clearly. Simpa. Very good. Pupillary dilation, pupillary constriction for sympathetic. Kung parasimpa, dilation, constriction. Kung simpa, dilation. Because you want to see your enemy better. Okay? Sige, very good.